What I'm going to demonstrate is the documentation of both neoplasms and some multiple procedures in the course of a single visit. A couple things for navigation. This is our facial mapping. So on the facial mapping, you notice as I hover over any areas on the face, it indicates what that area is. You also have the ability to do that on lateral head right, lateral head left, full body male, front and back, and you can see the level of detail, full body female, and you can also again see that great level of detail. As I go back to the face, the first thing I'm going to do is document a neoplasm uncertain. So as I touch on the neoplasm uncertain with punch biopsy, and I can also do just documentation of the lesions, but I'm going to do a procedure on this one, indicate it's on the left forehead, and I have some suspicion about this particular lesion, so I've got an ability to track the history on this, and you'll see how that works throughout the rest of the documentation. In the exam, I'll indicate the size, indicate anything else that I want to document with it, scaly, pearly, any free comments areas. So these text boxes are completely defined by you as far as whether you want to type in information, use drag and dictation in there, and then you can also indicate anything else that you wish. You're also going to tell it that it's suspicious of a basal cell carcinoma. Go take a look at your plan. Your plan information has defaulted information. It knows it's a punch biopsy because of how I documented that. And then any other comments you wish to put in here, you can put in unlimited comments here to document what you're going to be doing or what you want to indicate. The procedure then knows it's a punch biopsy. You simply indicate the size on the punch biopsy, how you're going to provide the anesthetic, CCs. Description of the procedure is defaulted based on the physician's preferences. You'll also document the closures. Maybe there's a couple of different closures on here. The closure type. If you gave post-op instructions, you'll indicate your physician, your assistants, and then at this point, go ahead and document your AKs. When you begin to look at the AKs, one of the options that you have is an ability to actually group AKs or warts or skin tags, because what you do for one, you may do 20 or 30 times on that same patient. So I'm going to group multiple AKs, and you notice that it tells me now that grouping is enabled. So now if I document multiple AKs, it's highlighted my documentation capabilities over here, and then I can go ahead and continue to doc multiple AKs and document those AKs across multiple body areas of the patient. So I'll just go ahead and click quite a few over here. Maybe you have a little bit of time to spend with this patient today. So now as I go through the documentation on here, I'll look at the plan. You can see the plan information again. Any comments areas over here, and then procedural information. It knows it's going to be cryosurgery. If we do any anesthetics on there, we can go ahead and put that. It knows the description of the procedure based on your preferences, and then if there's any closures, post-op instructions, who the physician was, and then that will finish the documentation for both the neoplasm and the multiple AKs. We'll close that out and take a look now at the note. So as I scroll up and look at the note, you'll notice now it's a very clean, readable format. Here's my skin exam, neoplasm uncertain left forehead, 2 by 3 millimeter. Also the AKs. You notice as well with the AKs, it counts by section, how many AKs in that particular section there were, and also totals those for you, and it'll make your billers happy because those are also totaled as well. You'll see the assessment on the neoplasm, the plan on the neoplasm and the AK, and then also the procedure on the punch biopsy. You can see the documentation for the punch biopsy over here, and then the multiple documentation for all of the cryosurgeries. Again, each area indicated, the totals, and then exactly what you did for those punch biopsies. At this point, I'm going to sign this document, and I'm going to close it out. I do have something that my nurse needs to do, which is she's going to go ahead and track the history of that particular punch biopsy. So as that punch biopsy, maybe it comes back a couple of days later, the nurse can come in here and document that. So as she goes into the documentation, she'll look at the lesion history, and because we documented history on it, notice I've got no data over here right now, but if I touch on here, it'll actually give me the history of the visit documentation. The nurse can simply go over here, continue to track that, indicate that it did come back as positive, put any comments over here, and the nurse, without the patient or without anybody there, she can go ahead and document that documentation and update that record. When that is updated, the nurse will go ahead and sign off on the document, and now we've got 2 different steps completed on the documentation for this patient, the lesion exam and the nurse's visit. When the patient returns into the clinic for maybe the procedure on that cancerous cell, then the physician will go into the documentation for that, look in the lesions, and in the lesions area, as they look at the historical area, notice now it's changed from the original shape and color to now a red C, so it's easily indicated that it's a basal cell carcinoma. Again, now when the physician touches on that, it'll actually show all the documentation previously compiled for this particular lesion. Physician can go ahead and continue tracking on here, and at this point they want to indicate they're going to do a new Mohs procedure on that lesion. So it launches my Mohs procedure documentation, and then you simply go ahead and document your Mohs procedure. So we can put that documentation in here, indicate the anesthetic, pre-medications over here, and then we'll just fill in some different data sets over here just for fun. Now you've got 10 different steps in the Mohs procedures, so you can document each one of those steps, and then you go to the Mohs closure. You have multiple different Mohs closure types. Each of those types can be specified by the preferences of the physician, and then that physician can simply go ahead and indicate what that is. So if it's a split thickness skin graft, here is the documentation for that particular type of procedure. Indicate the post-op wound size, indicate the flap size if there was, the donor site, and then again, suture documentation, multiple areas for the sutures, post-op vitals, indicate the pulse, the temperature, and any other documentation for the patient, and then also who the surgeon was. So at this point, the physician can go ahead and close this out, and we'll look at that note now for the Mohs procedure. And you can see here's the skin exam, the assessment, the Mohs operative report information, the Mohs specific closure information and documentation, and then also all of the follow-up data. As I end this update and sign that document, that really completes a full circle of the evaluation, the punch biopsy, the result coming back, and the documentation of the Mohs procedure in just a few short steps. You notice I virtually never touched the keyboard. Everything was done by the documentation on the mapping procedure. Now, if at any point that patient comes back in with anything else, I can go ahead and go into the new lesion. Nurse can take my HPI. When I go look in the exam, because I tracked history on that particular lesion, I can always go look at that and also see the history of that lesion inside the documentation. So if I'm doing other lesions and I want to look at what happened on this one, you have an ability to look at that data in a very clean and concise manner. That is a very quick overview of our graphical mapping documentation tool for Centricity EMR.